Okay, let's begin the audio lecture for Chapter 3 and Chapter 4. Chapter 3 deals with an introduction to the administrative applications of computers. This is the section in the book that talks a little bit about practice management, scheduling, and accounting. And of course, Chapter 4 focuses on the topic of telemedicine. Now, in Chapter 3, this should be a very familiar chapter to each of you, simply because most of you, by the time you've taken this course, you've already taken medical administrative practices. Just to kind of brief you a little bit on what that course was. You remember medical administrative practices, that was the course in which you learned how to do things inside of an electronic patient's chart. You was basically live in a patient's chart. All of your patients were fake patients, of course, but you were taught how to do things such as scheduling a patient for a consultation, or scheduling a patient just for a normal appointment, or scheduling a patient just to come in for labs. You learn how to cancel a patient's appointment, let's say it was requested by the patient, or if the doctor had to cancel appointments for a day because he was going to be out of town all of a sudden, or he had something else going on, he couldn't see patients. So you learn how to cancel appointments. You also learn how to reschedule appointments, whether they were whether they were requested by the patient, or again, something happened where the doctor had to do a rescheduling. So you learn how to do that. You also learn in medical admin practices, you learn how to post charges. You learn how to print patient receipts. You learn how to put in demographical information on patients, insurance, occupations. You learn how to put in diagnosis on patients, procedures and tests that they had done. You learn how to open and close cases on different patients. So you learn a good little bit from medical admin practices. Again, it is where you were live inside of a patient's chart and you were able to do a lot of different functions. What you probably is not aware is that the software that you use, called Metasoft, is a type of administrative software that is used whether it's in hospitals, doctor's offices, or other medical facilities. Now, I won't say that Metasoft is the only type of software used, because that's not the case. It's just that for that particular course, we had you all to use Metasoft. That was the actual practice management software that you use. And in that software, again, you were allowed to do multiple things. You were allowed to go in and restructure a patient's chart. Let's say, for an example, you had a patient that came in one day for some tests and procedures, and let's say, for example, they came back in and had x-rays done, or the doctor has put them on meds and stuff. You learn how to go in that patient's chart under the respective tab and input information. You learn how to put in comments on a patient. You learn how to input things that they were allergic to. So you've done all of this through administrative practices. So in Chapter 3, it just kind of refreshes your memory on that. So medical informatics is what we call that division of going in and doing anything on an administrative application base for patients. We call it medical informatics. It may come by way of clinical applications, and that's where there's direct patient contact or direct patient care being given to the patient by doctors, nurses, and other medical professionals. You have special purpose applications. These are your applications that deal with the educational side of the patient's chart, as well as pharmacy entries into the patient's chart. Then you have your administrative side. This is for your office and materials management. This is where you go and do scheduling. This is where you do accounting and financial applications. And what I mean by that, that is where you're going in and you're posting charges, you're posting transactions, you're doing balances and things of that nature, so that when patients come, you have access to be able to pull up that patient and let them know if they have a balance, or what's due today at their time of service. And the way to do that, you keep up with that in the patient's chart by way of the software that's being used. Medical informatics also has to do with telemedicine, and we're not going to spend time talking about that here because I'll make mention of that. That's what Chapter 4 covers in that respect. So practice management software, again, when you took admin practices, the name of that software was Metasoft. Okay, Metasoft did all of these things you see listed on this slide. It gave you the ability to organize patient data. You did case data on patient. You was able to put in provider information. You was able to do electronic progress notes. You were able to put in codes for diagnoses, treatments, insurance information. On the administrative side, again, as I mentioned before, on the administrative side, it was more or less about different type of office management tasks, okay? Whether it was scheduling. When we say scheduling, we're talking about making appointments in the patient's record for the office, okay? So, Metasoft is one example of practice management software. Office Hours is a type of software that's known as scheduling, okay? And the way they correlate with each other, when you're using Metasoft, that's helping you to get inside the patient's chart. When you're using Office Hours software, that's the section of the chart that allows you to open up the calendar so that you can choose the date, the time, the month that the patient's appointment needs to be scheduled. You also do accounting functions on the administrative side. And again, this is where you do charges, payments, and adjustments, or we call those transactions. Okay, so what's a charge? A charge is simply the amount a patient is billed for the provider's service. Payments are those things that are made, those are the amounts made by the patient or the insurance carrier to the practice. Okay, so either that patient is either making a private payment or payment is coming from their insurance company to the practice. An adjustment is what we call a positive or a negative change to a patient account. Positive adjustment would be us crediting money back to the patient. A negative charge for an adjustment would be us removing money from the patient's account. Okay, so if a patient had a $50, let's say for instance a patient had a $50 balance and today they walked in the office and paid $25, we would do a negative change. We will adjust their account in a negative way to remove the $25, which will leave them a balance of $25. But let's say the patient had $50 and we had to credit them $20 or $10. That's a positive change on the patient's account. Administrative tasks in a medical office include coding and billing, insurance, and payments. Practice management software allows what we call bucket billing. Bucket billing is where you bill one insured after another until the patient is billed. So let's say, for example, that patient has two different types of insurance. You'll bill that primary insurance first, and then whatever they don't pay, you turn around and bill the secondary insurance, and then whatever is left and whatever is the patient's responsibility after that moment, then that's when you actually bill the patient, and that's called bucket billing. The next slide, which is slide number, let's see, 4, 5, 6. Slide number 7 actually shows you a picture of Office Hours software. And if you notice, you see the calendar where you can choose the date. And on this particular slide, for this particular day, August the 5th, which is a Friday, there are at least already 3, 4, 5, 7, 8 patients already scheduled. Now, it could be something going on with each one of them where it could be that some of them have already canceled out or something like that, but it doesn't show that on this slide. It just shows where there's, 7 or 8 patients that are scheduled for Friday, August the 5th. Management software such as Metasoft allows you to go in and edit appointments. I talked about that at the beginning. So it's where you can edit. You may need to change a patient's room. You might need to change a patient's phone number. You might need to go in there and change their date. You may need to go from 8:05 to like 8:15, or you may want to stay 8:05, change them from 8 o'clock to 12 o'clock. So you have the option of doing this on the appointments. The next slide shows you what a transaction entry box look like, and this is where you're posting. You can see posted payments and adjustments that are being made. Balance billing is pretty much the way that works. Claim is filed with the primary insured, response and check is received, then a claim is filed with secondary insurance. Pretty much what I just mentioned a few minutes ago. So basically, after all claims have been filed with all insurers and all of the responses have been received, meaning that the physician's office has received their portion of the services that are to be paid, then that's when the patient can be billed. Databases are a collection of data on patients that's just kept in an organized manner, but it's kept by way of what we call DBMS, which is database management software. And basically it's just the ability for you to be able to go in and keep a lengthy database or a detailed database on patients that visit your facility. Databases can contain files. Files are the related records in relation to who the patients may be. You have records. Records are the data that is made up of fields. Fields is the piece of information in the record. Key fields, uniquely identified records. So when I say key fields, those would be things like date of birth, or maybe you got it organized by medical record number. Maybe you have it organized by social security number. Coding and grouping systems. These are the different type of systems that are used inside of patients' medical records. Of course, your CPT and your ICD, they all have to do with your coding and the procedures that are done for patients when they come into the office. Your MedSyn are your codes for symptoms related to the patient's history, patient exams, and in addition to that, tests, diagnosis, and treatments. You have the SNOMED, the LOINC. Those are your laboratory and clinical codes. And then you have your NDC codes. Those are the ones in relation to the different drugs and medications that are administered to the patient. Now, a minute ago, I mentioned about bucket billing. Bucket billing has to do with submitting claims. If you remember from previous classes, claims are the most common way doctors' offices are billed for their services and how they receive funds for their services. And the most common form that is used in a doctor's office is what we call the CMS 1500 form. I have a picture of it right here, figure 3.4 in the notes. So when you're submitting claims is a part of, it holds several parts. One of those parts is accounting. That's where transactions, charges, payments, and adjustments, cases, those conditions that bring the patient to the doctor's office, it is those things that figure into, or those things that become part of the CMS 1500 form that gives you the information that you need to be able to submit the claim form in order to retrieve the monies needed for the services that you provided. Those resources or monies that are due back to the facility. Again, when you're scheduling in administrative software, basically you just making appointments electronically. I have a picture of another picture of the office hours in here, so you can see that once again as to how that looks. Okay, and again, this is from a piece of Metasoft. Insurance can be several different plans. You may have fee for service. You can have HMOs, or you can have PPOs. You also have types of insurances that are regulated by government. That's your Medicare, Medicaid, TRICARE, Chap, Workman's Comp. And if you remember from previous classes, as a refresher, Medicare and Medicaid services, always know that they are governmental insurances that are regulated by CMS. When you make a claim that's requesting payment from an insured, it can be submitted electronically or on paper. 99.9% of the time it's going to be submitted electronically. There are times you may have to send in a paper claim, and in those instances, that's usually when the insurance company has requested that. But other than that, unless they request it, you automatically send it electronically. The UB04 claim form, you mostly see that being submitted in as it relates to hospital and Medicare patients. And so there's two slides that show you what a picture of a UB, well, there's the first two slides to kind of show you, these are the claim form and instructions, but the next two slides actually show you the actual UB04 form. Most of you have already taken Managing Healthcare Information, and so you've learned about the form there. A lot of you have taken medical insurance processes. You've learned about the form in there. In medical insurance processes, you actually had to submit claim forms. And students usually have to submit claim forms for the UB04 and the CMS 1500. So these forms that you're seeing here today in the slides, they're merely nothing but a refresher for you. What are response to claims? They may come two ways. You can have an ERA, which is electronic remittance advice, and then you have the EOB. The ERA goes to the facility, and basically it shows the facility on a given day what patients were listed on that day, services they had done, and vice versa. Versus the EOB, it goes to the patient. That shows the patient or explains to the patient the services that they had done, and it also explains why certain services were not covered and others were. It also takes it a step further to show them what was covered and how much of it was covered. And then again, in conclusion, the bucket billing, again, what is the bucket billing and why is it significant? And again, it allows medical offices to accommodate the insurers. The insurers are the individuals that come to the office with the insurance. It helps them by submitting the claims for them, and it does it in a timely fashion so that the claim can get paid fast, and if the patient is owed something to the facility, that also can get generated and billed out to the patient in a timely manner, because the sooner that happens, the sooner the physician's office can get billed for all services they have to the patient. Accounts receivable, that is the office that handles invoices and payments from patients and insurance carriers. Super bill, this is the form that shows the list of diagnoses and procedures a patient had done, and here's an example in figure 3.6. This is an example of a super bill, also known as an encounter form. You see all the demographical information at the top, but at the middle section, that's where everything is marked that that patient had done for that day. Anything that's not on there is automatically written in on the super bill. Affordable Care Act, we know that was the act 2010 signed into law by President Obama, and basically what it was done was giving individuals an opportunity to buy health insurance. It was a requirement for them, but it was to be done in a way where it was reasonable for them to be able to afford it. Everybody pretty much had to buy at least the minimal amount of coverage in order to be covered. And you know, now if you don't have insurance, you're penalized for it at the end of the tax year. This particular slide shows you the requirements to be able to apply for it. Anybody with an income below 4 times the federal poverty level, basically qualified. 88,000 for a family of 4, 44,000 for an individual. They also will be eligible for some sort of coverage as well. Anybody who had an income 3 to 4 times the poverty level would not have to pay more than 10% of their income for the health insurance. These are the things that was factored into the law that was passed. Children could not be denied coverage because they had a pre-existing condition, and children can also stay on their parents' insurance plan until they were the age of 26. And lastly, reports. In administrative applications-based programs, you have reports that are usually printed or generated on a daily basis. Okay, those reports are listed here on the slide. You have what you call the procedure day sheet, and basically that is a grouped report organized by procedure. So basically, patients who underwent a particular procedure, such as a blood sugar test, will be listed under that procedure. This report is used to see what produces or what procedures a health worker is performing. The payment day sheet is a report that's organized by providers. Each patient is listed under his or her provider, and it shows the amounts received from each patient to each provider. Patient day sheets list the days, patients, chart numbers, and transactions. It's basically used for daily reconciliation. Then you have the practice analysis report. This is a report that's generated on a monthly basis, and basically it is a summarization of all procedures, charges, transactions for the month. And lastly, you have a patient aging report. It is used to show a patient's outstanding payments. So that will include current and past due balances. And for an example, this can be for accounts that are 30 to 60 days, 60 to 90 days overdue, and over 90 days. All right, that concludes our notes for Chapter 3. So we're going to move right into Chapter 4, which is on telemedicine. So by definition, telemedicine is basically, by definition, it is basically the use of computers and telecommunications for healthcare given at a distance. That's basically what that is. That's basically what telemedicine is. Now, a lot of people have their personal feelings and personal take about telemedicine. And of course, that's just what it is. It's a personal take of how you feel about that. You know, how do you feel about video conferencing over the internet with your physician, and he's, you know, diagnosing you and telling you what to do and all that kind of stuff, and you having a consultation with him, and the difference is versus you being face-to-face with him in a room, you're face-to-face with him across the internet. Now, one of the types of instrumentations that is used for telemedicine is what we call the Mediport. This is figure 4.1. And these are the mobile devices that are used for you to be able to video conference or teleconference with your physician. It allows them to provide that consultation for you. It's done in real time, but it's done from a distance. Okay, then the next slide, 4.1, that is the quad port. Interactive video conferencing basically allows the doctor to consult with patients at a particular site, where basically is where the doctor is at one site and the patient's at another site, but it allows them to video and interact with each other. Okay, so figure 4.2 kind of shows you what a telemedicine consultation would look like. You see the physician on the screen. At the top, you see the little webcam. So you're able to see, and you see how he's showing different pictures and stuff at the bottom. That's pretty much what it would feel like. Telemedicine is growing. It was predicted that by 2010 there will be more than 2,500 institutions participating in telemedicine. And of course it continues to grow. Telemedicine has been used in prison for years, and it's growing because the prison population is growing. Okay. How is it used? Used by way of Bluetooth technology. So like for an example, a pacemaker senses a dangerous event. The cell phone automatically calls 911. Okay, that's just an example of how diverse technology is, where you can have your pacemaker hooked to where when it goes off, it automatically like send a signal to your cell, and your cell automatically calls 911. Let them know, in the event you're unable to speak or talk, to let them know what's going on. Now let's talk about some different subspecialties of telemedicine. The first one being teleradiology. Okay. So with teleradiology, it is the oldest form of telemedicine, and basically it involves sending radiological images in digital form over telecommunication lines. Then you have telepathology. It is the transmission of microscopic images over telecommunication lines. Basically, the pathology sees images on a monitor instead of looking under a microscope. Dermatology and ophthalmology. Dermatology is the practice of using dermatology over telecommunication networks. It is based partly on the study of images. It uses both video conferencing and store and forward technology. Then you have ophthalmology. Of course, that is the telemedicine that is used to review and discuss optical images as pertains to the eye. And again, it's done over telecommunication lines. Telecardiology. During the 1960s, or by the 1960s, it became possible to take heart sounds and accurately transmit them and fax them to EKG machines. In the 1990s, echocardiograms could become telecommunicated, and it did around the 1990s. Okay. In 2009, there was a study done in Italy that proved that telemedicine could correctly diagnose heart attacks if an elderly person had one at home. Okay. So in 2009, it was proven telecardiology was good in improving diagnoses and delivering treatment a lot more quickly through telemedicine. Okay, now let's look into teleneurology. Teleneurology, this deals with those type of diseases that have to do with the nerve system. So you have what we call, one of the benefits of teleneurology is telestroke. So one of the recognized benefits of telemedicine in using telestrokes is saving time. Time is essential in treating strokes. So is expertise. So using telemedicine was found to be effective in stroke rehabilitation programs. It improved both balancing and functioning. Epilepsy uses email and video conferences for real-time meetings. The patient is with a nurse at one location. The neurologist is at a distant location. In using video conferencing, the neurologist can take a history and direct and see the physical examination of the patient. The neurologist can also diagnose the patient and create a treatment plan. In Parkinson's disease involves damage to the brain cells that inhibits brain communication, have to do with balance, movement, walking, and speech. So telemedicine examinations of patients' motor skills were equivalent to an in-person evaluation, so it was proven to be found effective. For Parkinson's disease, the telemedicine visits in nursing home were conducted in a room with a flat screen TV in which the patients could see their doctors. And of course, a nurse accompanied the patient during the process. Telepsychiatry involves the delivery of therapy using teleconferencing. Some studies have found that patients were more comfortable talking to a distant psychiatrist, believe it or not. It's not appropriate for all conditions dealing with psychiatry, but it was effective for some of the conditions. So remote monitoring devices has its advantages, of course. It makes it possible for patients to be monitored at home from afar, not necessarily in front of the doctor. Here's an example, 4.3, of a patient who was using a spirometer, digital report electronically that could be pulled up for the doctor to see and monitor. You got telewound care. So telewound care is relatively new. It became existent around 2011. Telewound care can increase access to specialists not only in rural areas but also in cities. Of course, critical wound care would require assessment and therefore frequent visits to the doctor. So although you probably could use this to talk with the doctor, when it comes to actually changing out the wound or treating the wound, you would really need to go and have frequent visits in order for that to happen. Because wounds are one of those things that are pretty sensitive. You have to really know what you're doing and make sure you maintain and take care of them. Telehome care, basically being able to televise or video conference patients while they're at home recovering, or if they're restrained to their bed. In telehome care, the patient can communicate to a nurse at a distant location. They can also speak to the nurse. Telehome care has been proven to cut down on rehospitalizations and ER visits, along with reducing hospital stays. Telemedicine in prisons has helped to improve medical care with both inmates and prison officials. It is very cost effective. It does have enhanced security that comes along with it, of course. Then there are some other uses of telemedicine, such as the Baby Care Link. It was originated in Massachusetts. The purpose of it was to compare high-risk premature infants receiving traditional care with an experimental group. One purpose of Baby Care Link to see whether patients felt more comfortable and knowledgeable about their baby's care so that the hospital stay would be shorter. So it was a way to kind of cut down on hospital care as well, or hospital visits also. Then you have telemedicine used in daycare facilities. You have telemedicine that may be used for weight management programs, pain management programs, spinal cord injuries. Safe Life. Safe Life is the piece of technology that uses smartphones and PDAs to deliver information to healthcare workers in remote areas. Vertebot. These are new developments in telemedicine. Vertebot is used for performing autopsies by way of scanning the body and taking high definition images. This of course is done using 3D images, and again, this is a new form of telemedicine that is, upcoming. One other new piece of telemedicine that's new is iBrain. It's used currently in clinical trials, and it's used in patients that are going through sleep apnea clinical trials. You got teletriage, remote house calls. And again, your book goes into much deeper depth in these. So make sure you do go back through your chapters and read in depth on all of these different type of new and current advances in telemedicine. Smartphones, we already know. Those of us who have smartphones, you can just about do anything. You can download stress reduction programs, fitness and weight control programs. You can do medication reminders. There's so much to do with these smartphones. I put you a list in figure 4.4 of smartphones. They're all pretty much touch screen now, of course. Then you got tablet computers. That's just where we're going now. When you go in the doctor's office, he comes in your room, or you go in the hospital, he comes in your hospital room, and he's taking notes, assessing records, assessing medical references, viewing medical images. He can do a lot of that just simply on a little tablet computer, something that he just takes around with him all the time. So technology is really advancing. You can use tablet computers for clinical apps, medication checkers, drug databases. Everything has to be HIPAA compliant though. Anything that the doctor looks up, any information he gathers from you, whatever information is put in on the system on you, he has to make sure that he's in compliance with HIPAA. I put you a picture of a tablet in figure 4.5. There are technical, legal, privacy issues associated with telemedicine, such as licensing, medical liabilities, insurance, privacy concerns, reimbursements. All of that has to be taken into consideration because telemedicine is still a form of the doctor providing care to the patient, so he still has to get paid for his services. Some other issues. Sound, voice, images, text, motion videos, high-speed internet, broadband media. All of these are some potential issues that occur with telemedicine. It's just like with anything else that you do electronically. You got to be able to see things clearly, hear things clearly, because you want to make sure if you're asking the doctor about a particular medicine, you want to be sure that you can hear him clear in what he's saying. So those are just a few of the issues that currently with telemedicine. So is it effective? Well, there are a whole lot of studies out about it. There are very few conclusions about whether it's both effective and efficient. Of course, there's still ongoing studies about that. It does have the potential of making quality care accessible to anyone, regardless of where they live. But again, it's hard to say now whether or not it truly is effective. Well, okay, that concludes the notes for chapters 3 and 4. This will be uploaded into the portal, so that you can go back and review if you need to. Also, The notes for chapter 3 and 4 are located in Doc Sharon separately. So you'll have a separate set for chapter 3 and a separate set for chapter 4. Again, do go back and make sure you read your chapters on chapters 3 and 4 in depth so that you can review what I've already gone over in the notes, but also apply those concepts along with learning the rest of the concepts in the chapters. Thank you.